Hey, good morning, everybody. And I want to start off by thanking the ranking member of HELP, Senator Murray, the ranking member of Finance, for being here, along with the great head of our DPCC, Chair Debbie Stabenow, who put this event together. Now, yesterday, President Trump rolled out his big budget proposal for the fiscal year 21. For the third year running, the president's budget would slash funding for health care, cutting it to the bone. $1 trillion in cuts to Medicaid and Affordable Care Act tax credits, hundreds of billions in cuts to Medicare, and millions of American lives in jeopardy over the next 10 years. The president's budget makes clear that his pledge at the State of the Union that he'd protect Americans with pre-existing conditions is nothing less than a bald-faced lie. And we're used to that with this president. He gives a great State of the Union speech with all these nice things. That's what he says. But then what he does, the budget, is the opposite. Totally hypocritical, slashing health care. If the proposed cuts make it through, 20 million Americans could find themselves uninsured. That's the same number of people that would lose coverage if the Republican lawsuit to strike down the Affordable Care Act succeeds. And over time, these proposed cuts are going to make our health care even less affordable for working families, providing fewer protections. President Trump's budget not only exposes his alarming immediate plans to take away Americans' health care, but also exposes the utter bankruptcy of the president's administration for the future. Americans, he doesn't care about your health care. He cares about the special interests who demand he just cut everything. The president's budget typically includes the administration's proposal to replace the ACA. It's usually heartless, it's usually cruel, but this year, he dismantles our health care system and puts nothing in its place. The American people made clear that their real priority is for health care. The Trump administration makes clear that their real priority is the complete destruction of health care and the health care system. Another point, President Trump's budget proposes a $35 million cut to the CDC's Infectious Disease Rapid Response Reserve Fund. This is the fund that we use to deal with infectious diseases like the coronavirus outbreak. The administration has the audacity to frame these cuts as, quote, cost-saving measures, cost-saving on the backs of the American people, on the health of members of your families, Americans. They're stupid, dangerous, and cruel. If there were ever a question about who's really fighting to protect Americans' health care, the budget should put those questions to rest. It's certainly not President Trump. And if President Trump gets his wish, millions of Americans would lose access to their health care and suffer tremendously. But we're here to assure Americans. Democrats refuse to let this happen. We will not let this happen. We will keep fighting against the president's cruel sabotage efforts. And now, Senator Stabenow, and I will have to bid you adieu.
Yes, thank you, Chuck.
Thanks for coming.
Very much. Thank you for coming. Obviously, we are joined here together because we understand that healthcare is personal. It's personal for everyone that's here, right? It's personal for all of us and our families. It's not political, even though over and over again, it's amazing to me to see how President Trump and the Republicans think this is just a political football. But it's people's lives that we're talking about. And so I'm so glad to be here with my colleagues and also Christina Perez Edmonds, who will be speaking on behalf of Oscar and all the other children that we are fighting so hard to be able to protect in terms of their health care. And Dr. Krishna Narasimhan, who is with Howard University and a board member of Doctors for America. Thank you, and to all the other physicians that are here. Let me just stress again, this is the fourth year in a row that President Trump has put the American people last when it comes to health care. Every year he stands up, State of the Union, I want to make sure there's coverage for people with pre-existing conditions. Of course I'm not going to cut Medicare. Of course we're not going to cut people's health care. And then they turn right around in the budget and do it when they couldn't get it through the Congress. at the repeal. Then they ran to the courts, and they're doing everything they can to undermine people's health care. As was said, in the budget, President Trump cuts health care spending by $1.6 trillion over the next 10 years, and nearly a trillion of that is cuts in Medicaid, which, by the way, is not only children and families. 3 out of 5 seniors in nursing homes in Michigan have their health care paid for through Medicaid, and over $500 billion in cuts to Medicare. And these cover millions and millions of families. Oscar's family relies on Medicaid to get him the health care he needs. Without it, they would go bankrupt like many, many other families. And I've seen this in my own family with my nephew and his family with a medically fragile child. And without health care coverage for little Leighton, I know they would have been one of the folks probably filing for bankruptcy, because my family would have done everything possible to make sure Leighton got what she needed. That's what happens to families over and over again. So in the State of the Union, he promised he would protect people with pre-existing conditions, yet nothing in this budget stops the Trump administration's unending attack on health care, as I mentioned, including a lawsuit that will rip away health care coverage. And he's done everything within his power, from undermining the insurance plans on the market by selling these cheap plans that we call junk plans that are less expensive. Why? Because they don't cover anything. Families don't know. They think, great, I'm signing up for this plan that just costs a little bit a month, and then somebody gets sick and they find out it doesn't cover them. They can get dropped if they get sick. They aren't covered if they have a pre-existing condition. And so that's what they're putting into the marketplace right now, which is, by the way, driving up costs, not down. They've eliminated funding for the folks that help people sign up for health care. On the first day in office, President Trump actually slashed the funding for folks to let them know when open enrollment was. You know, if you sign up for insurance, you get a notice open enrollment. They've tried to hide the open enrollment process, and now they are cutting Medicare and Medicaid again. So let me just close by saying healthcare is personal to everyone. It is not political. And when President Trump and the Republicans try to take healthcare away from families, the people up here take it personally. We take it personally. The people in this room take it personally. Every family in Michigan and across the country deserves high-quality, affordable healthcare. We know there's work to do to truly make that happen, but it's not by ripping health care away from children and families. So it's time for this president to put people above politics. Senator Patty Murray, our great ranking member in the Health Committee.
All right. Well, thank you, Senator Stabenow, and to everyone up here, but especially to Christina and Dr. Narasimhan, who you will hear from just shortly, for sharing their experience and expertise. I've always said that a budget is a statement of your values and your priorities. And that is certainly true of the president's budget, which we just got, which shows his values and priorities, which are completely backward. We know President Trump likes to pick winners and losers. This budget does that. It picks winners of the very few who are very wealthy and the biggest corporations. They're the winners. But who the losers are families nationwide who need affordable, quality health care. This budget extends unnecessary tax cuts for those at the very top and those who are least in need of our taxpayer dollars. But how he does that is by cutting more than $1.5 trillion in Medicare, Medicaid, and other healthcare programs. $1 trillion which will come from Medicaid alone. We've now had 3 years of this president making and breaking promises on health care at every single turn and jeopardizing people's coverage in the process. In fact, just last week in the State of the Union address, he falsely again claimed to be champion of protections for pre-existing conditions, even as this administration is in court spearheading an effort to take those protections away. Now, I'm sure the president is hoping people will not notice his lies or will not look at how hard these harmful policies are, but they are. And we are here today to make very clear that Democrats do notice. And we know people across this country notice. And we are not going to stop standing up for patients or shining a spotlight on how badly his plans would hurt people that we represent. So that's why we're here today, and we really appreciate all of our guests, but first we're going to hear from Senator Ron Wyden.
Thank you, Senator
Finance
Murray and Senator Stabenow, and to Christina and the good doctor. The first point, and Senator Murray touched on this, the president spends an enormous amount of time running about the country saying that he is the champ of the working person, the hardworking, working person. Make no mistake about what that person is getting right now. That person is, in effect, seeing tax breaks go out to all of those folks at the top, and the people that we care so deeply about, in effect, a lot of working families subsidize those breaks for people at the top. So my colleagues have said it very well, and I've just got a couple of quick points. First, at the exact moment Donald Trump said that he was going to be defending pre-existing condition protections, he had his lawyers off in federal court pushing to rip them away from all Americans. Big gap between the promise and what his lawyers were all about. That is what my kids, and we have small children, would call a really big whopper. Now, my colleagues have done an excellent job laying out what the budget is all about for families, and I just want to give you a couple of additional examples. Our committee has jurisdiction over Medicaid, which is a lifeline for so many poor and vulnerable people. On top of the hundreds of billions in cuts into Medicaid in his budget, Donald Trump has proposed cutting Medicaid by an additional $50 billion a year. There is no way that long-term care programs, nursing home programs, can handle those losses without shutting down or reducing services to frightening levels. The fact is, apparently, this is something that has not found its way to the president's radar. Medicaid helps pay for 2/3 of the seniors who are in nursing homes. So once again, somebody who says he's the champ of working families, many of whom rely on that long-term care benefit, they're going to see it slashed, while the tax breaks go to the folks at the top. It doesn't stop there. Donald Trump's vision for American health care says you can block grant Medicaid. In effect, what that means is you're going to basically unravel the safety net. And the Trump healthcare agenda creates hundreds of cracks in the safety net that vulnerable Americans are going to fall through. A pregnant woman could have her coverage ripped away from her in the middle of her pregnancy or just shortly after her delivery. Somebody with a cancer diagnosis who loses their job could have nowhere to turn. A young person struggling to afford insulin could be asked to pay copays that were unaffordable. And I can tell you what I hear at home is story after story of people already cutting their insulin pills in half because they can't afford them. And these cuts are going to make those kinds of services even more affordable. So we're going to spend this week talking about what we hear in the real world, not just those country clubs and places where Donald Trump is willing to walk in and say, I got you a big tax cut. I mean, that actually happened after we in the Finance Committee with Senator Stabenow and all our colleagues battled to get a bill that would help the middle class. Most of the breaks went to the people at the top, and what did the president do? He immediately went out and said to those, his friends, who are at the top of the economic pyramid in America, I got you a big tax cut. And we're saying we're going to make sure that the American people understand how out of whack these priorities are. And literally, if you look at the tax code now, we're going to be in the position where a lot of working families are essentially absorbing these cuts we're talking about, and they're in effect going to see taxes they pay subsidize extra breaks for people at the top. So Senator Stabenow, great work as usual, and I guess we're going to hear from our guests.
Yes, we're going to hear. Come on over, Christina and Oscar. All right. Hi. How are you? You're looking so good.
Good morning. My name is Christina Perez Edmonds, and it is an honor to speak here today. I am a proud first-generation American daughter of a Cuban refugee and proud mother to my beautiful son, Oscar. Oscar is a strong, happy, beautiful boy with big brown eyes who's about to turn 4. He loves books and bath time and has amazing hair. Oscar was born with an extremely rare chromosomal deletion. There is only one other person in the entire world with the exact same missing genetic material. Because of this diagnosis, Oscar lives with stage 3 kidney disease, heart disease, and brain abnormalities, which has required endless testing, appointments, and even surgeries. He requires a feeding tube for nutrition, as he has trouble swallowing and is a wheelchair user, although he works extremely hard to gain mobility in his many therapy appointments. Oscar was born prematurely, and his father and I thought he just needed some time to catch up. Unfortunately, it became quite clear that we had a much longer road ahead of us than we anticipated. As parents, our ultimate goal is to raise a son who is independent, and any milestone towards that is a cause for huge celebration. I want you to think of your own children asleep at night in their cribs or beds. Perhaps the temperature has dropped in the house and their blanket has made its way to the other side of the bed. I'd imagine your children might wake up, grab their blanket, get themselves cozy, and fall back asleep. Or perhaps they'd walk into your room and say, "Mommy, Daddy, I'm cold. Can you come tuck me in?" This is a privilege that many of us parents of medically complex children do not take for granted. My child is nonverbal and does not have independent mobility. He cannot walk into our room in the middle of the night to tell us if he's cold or uncomfortable or having a bad dream. It has been 4 years of intensive therapies to get where we are so far. It would be a year before Oski could sit on his own, 2 years before he could say mama and dada, 3 years before he would figure out how to go forward in his walker, and this year he's learned how to scoot forward. But the ability to learn these things comes at a hefty price. An initial consultation for therapy is $500. That's just for someone to watch him for an hour and discern what he needs from therapy. Each session after that is $150 each, 2 to 3 times a week, all year round. The wheelchair you see him in right now was around $6,000, and the gait trainer he has at home is another $4,000. The gait trainer, until a few weeks ago, has been his only mode of independent mobility. Add to that the cost of his formula, which must be administered via G-tube. Altogether, just to meet the basic needs of eating and learning how to move, our family is staring at a bill of approximately $30,000 a year, not including doctor's appointments, ER visits, diapers, and the surgeries that lie ahead. $30,000 a year is someone's salary. For many families like us out there, Medicaid is literally a lifesaver. Children like mine require full-time caregiving and may require that for the rest of their lives. This usually means one parent has to quit working, like I did, to take care of their child full-time. Without Medicaid, families will have to choose between allowing their child the opportunity for mobility or making rent, teaching their child how to speak or fixing the roof, teaching their child how to eat or fixing their car. Simply put, without Medicaid, most families like ours would be bankrupt. The other night, when we put Oscar to bed, he grabbed his blanket, pulled it over himself, rolled over, and fell asleep. He is able to do that in a comfortable home, in a comfortable bed, because of Medicaid. Yesterday, President Trump released his new budget, including detrimental cuts to Medicaid. This will, without a doubt, reduce or even eliminate accessibility to the life-saving benefits that medically complex children like mine rely on to survive and thrive.
Thank you so much, Kristen. That was wonderful. Doctor, yes, thank you so much.
Well, thank you, Christine. Thank you, Oscar. My name is Krishnan Narasimhan, and I'm a family medicine physician. So I'll tell you what I know. Okay, I know that my patients tell me every day that they're worried about coverage and affordability. And if they don't have both of those things, the consequences for their lives can be devastating. Let me tell you about one of my patients. She's a 43-year-old woman who did not go to a doctor for 10 years. Because of the Medicaid expansion through the Affordable Care Act, she came to see me for a regular physical. We did a simple pap smear and found out she had advanced cervical cancer. Luckily, she had Medicaid and was able to get the cancer care that was life-saving for her. But what happens if the massive cuts to Medicaid and Medicare go through as are proposed in the administration's budget? Well, if the block grant money runs out, or if my patient doesn't work, she doesn't get the cancer care that she needs to live a long and happy life. That's the reality for millions of Americans. And that's why these type of short-sighted cuts are something we should oppose and stay strong against. Another issue is drug pricing and affordability. So every diabetic in America knows this, but I know my patients struggle with affording the skyrocketing prices of their insulin. A lot of them go without it for weeks, for months. They end up in the hospital. We know that many of our patients with allergies are giving up or foregoing needed emergency care through their EpiPens. They can literally save their lives, but they can't afford them. So look, there's been a lot of talk about making drug pricing more affordable, but we do need some action, and there's some common sense solutions like H.R. 3 and the Bipartisan Drug Pricing Reduction Act that Senators Wyden and Grassley are supporting. We'd like to see the administration help support the passage of those to really back up the talk and get something done for the American public. So, why are we all up here? We've got patients, families, doctors, lawmakers. Why are we taking time out to talk to you? It's because we know how serious these consequences can be. So we all stand united here to oppose these serious cuts to funding that would shatter the safety net and really decrease coverage for millions of Americans. But I think we also can stand united and work together to really achieve a vision of a high-quality, affordable healthcare system for everybody. And I think we can make that happen. Thank you.
Thank you so much. Thank you very much. Before opening questions, let me just emphasize again that this is really about a budget that's betraying children, families, seniors, all of us, people that are counting on having the opportunity to have affordable quality health care. And as the doctor mentions, instead of ripping healthcare apart, we want to be working together on lowering the cost of prescription drugs. I mean, the biggest driver of costs is in prescription drugs, and we are willing to stand up to the pharmaceutical industry and have been doing that to say no. and to say we need to bring down these costs that directly affect the overall cost of healthcare and the individual costs for families. So we're happy to take any questions. Yes?
Senator Wyden, I was wondering, what is the outlook for the prescription drug bill?
I think we understand what the prescription drug fight is all about. As of today, Mitch McConnell is standing with Big Pharma. All of us are standing with the patients and the physicians and the consumer who is getting mugged at the pharmacy counter. This isn't real complicated. And so one of the reasons we wanted to get together and why Senator Stabenow brings these kind of real stories about American health care to the public is political change doesn't always start in Washington, D.C. and trickle down. Right now, it's bottom up. And I heard mention, the president said that, he wants to see a bipartisan bill. It'd be really helpful if he'd get on the phone and he'd tell Republican senators and Mitch McConnell, I want you to be willing to work for a bipartisan bill that stops the pharmaceutical price gouging rather than standing up for these lobbies. So that's where it is today. And I can tell you, we're going to be speaking out about this every single day because there is something really out of whack in America on things like insulin. Insulin prices have gone up 13-fold in recent years. The drug is not 13 times better. It's basically the same drug. And the reason the price gouging is going on is because Big Pharma works so hard with all their lobbyists to keep it in place. We're going to take it on, and that's what we hope all of you in the news media will do is get the word out about what the fight's about.
What's your opinion of the House bill?
Well, what we have said, and Senator Stabenow, a very valuable member of the committee, we believe deeply in the idea that you ought to be able to negotiate to hold down prices. And we had a vote, in fact, in the Finance Committee for a Stabenow amendment to do that. It is in the House bill. What I would hope is, at a minimum, Senator McConnell would stop siding with Big Pharma and say, hey, look, the House bill also has much of what we have in our bill. There's a way to get a bipartisan bill, but make no mistake about it. Big Pharma is against the Senate bipartisan bill.
Right.
Big Pharma is against the House bill. Big Pharma basically does not show that they'll support anything except business as usual with their price hikes, and then they'll blame so-and-so and so-and-so and so-and-so, and they can keep doing business as usual. We're up here to say we're going to end business as usual, and obviously the House wants to too.
And let me just stress as well, and Senator Wyden said this so well, I mean, it starts with the basic, which is Medicare should be able to negotiate group prices. I mean, the VA does that for veterans and cuts prices about 40%. And so the House has a way of doing that. We'd love to see the House bill come to the floor and address issues through there. We have a bill that came out of committee. Senator Wyden indicated my amendment did not get one Republican vote in the Finance Committee, which was deeply concerning. But when a bill comes to the floor, we're going to demand a vote on Medicare negotiation to be able to move forward. Finally, just one point on insulin. Insulin was actually developed over 100 years ago. 100 years ago, the basic form. It's off patent. They've recovered their costs. And in fact, the people who developed it were Canadian physicians who didn't want to make any money off of it because they felt this was something that was so important to the public and quality of healthcare and life that they gave the patent for $1 to the University of Toledo. Or was it? Yes, I think it was not Toledo, Toronto, University of Toronto. And so that formula, basic formula, has been around for 100 years. There's no excuse for this. The reason they are high prices is because they can charge high prices. And right now there's no accountability. And that's what we want to bring. Any other questions? Yes, sir.
May I ask, on the Medicare proposals in the budget proposal, they list things like waste, fraud, and abuse and site-neutral payments that supposedly are not supposed to be just cuts to benefits. What do you think the actual effect on patients would be for the Medicare proposals, and why do you oppose that?
Well, what they always do is try to shroud, to hide the fact that invariably when they set a budget, they leave out all the details, and then they send their team from the Department of Health and Human Services and other relevant agencies to go out and undermine the program. This is a really basic debate. It's not complicated. We believe that there is a Medicare guarantee and a Medicaid guarantee. They're guaranteed benefits. I don't think that is something Donald Trump is willing to clearly state he's for. When it is politically advantageous, he'll stand up and say, I want lower prices. I'm not going to cut Medicare, not going to cut Social Security. You know what he's doing on Social Security? Made a big deal. Oh, I'm not going to cut Social Security. He's going after the most vulnerable people, the disabled folks on Social Security, because he thinks that that's something he can get away with. So you're going to hear, as has always been the case, a lot of vague language about protecting Social Security and Medicare and Medicaid and the like, and that he's not going to hurt anybody, but he's going to get it all out of fraud and abuse, and we have seen what that means. In terms of Medicaid, he is going to cut the guarantee for benefits like nursing home coverage. 2 out of 3 patients depend on it. We can be sure that the tax breaks for the people at the top aren't written in vague, nebulous language. They've been in black letter law. And in fact, Senator Brown and I will shortly be introducing legislation because, as if that wasn't enough for these greedy special interests, now they're going behind closed doors and trying to wring out even more breaks. And Senator Brown and I will have something to say about that very, very shortly. So appreciate the question.
All right. Do we have any other questions? One more question? All right. Well, thank you very much. And thank you to